This is Tim Sandlin with the 102nd Intelligence Wing Public Affairs Office with the latest news from the wing. Soldiers and airmen from the Massachusetts National Guard who have civilian medical training have been assisting nursing facilities with additional medical care, helping the Commonwealth's fight against COVID-19. Activated to serve with Task Force Raptor, these Guard members are augmenting skilled nursing facilities across the state. Captain Bonnie Blakely tells us more of the story.
More than 180 soldiers and airmen from the Massachusetts National Guard with civilian medical backgrounds have been called up to serve with Task Force Raptor and join the Commonwealth's fight against COVID-19. Unique to Task Force Raptor, the Guard members on this mission have civilian medical training and were activated regardless of their traditional Army Military Occupational Specialty, MOS, or Air Force Specialty Code, AFSC. Air Force Tech Sergeant Kyla Collins is one airman called up for Task Force Raptor. She said, "In the Guard, I'm an airfield systems installer and often work installing base telecommunications. My unit knew that I had a nursing license and therefore asked if I would be willing to function as a nurse for this mission." Close quote. In her civilian life, Collins works as an emergency department nurse in central Massachusetts. As an airman, she serves in the 212th Engineering Installation Squadron, part of the 102nd Intelligence Wing. "I am happy and honored to be able to fill this role and help out the facilities that need it most," Collins said. "Even though it's not my primary AFSC, I am a nurse on the outside because I love what I do, and as a member of the National Guard, I am here to help my country and state in any capacity possible." Close quote. The task force is broken down into 11 different teams, each composed of various medical specialists, including emergency medical technicians, paramedics, certified nurse assistants, physician assistants, and registered nurses. Each team member brings a specialized background to their group, regardless of rank. Another member from the 102nd Intelligence Wing who is serving on this mission is Captain Mark McAndrew. He is the officer in charge for Task Force Raptor Team Golf, and here's what he had to say about his experience so far.
That's another great thing about the National Guard. There's a bit of a mismatch, I think, between our military MOSs and AFSCs and what we do on the civilian side, but we bring such a diverse set of skills that got put to the wayside very quickly.
As a civilian, McAndrew serves as a full-time firefighter EMT, and in his part-time National Guard career, he is currently the 102nd Intelligence Wing Anti-Terrorism Officer. This specific task force was designed to support the Massachusetts Department of Public Health and Health and Human Services by providing additional assistance to healthcare facilities across the state. Air Force Captain Eric Jividin is the officer in charge for Task Force Raptor Team Kilo. He works as a civilian physician's assistant and is part of the 102nd Medical Group Detachment 1 in the Air National Guard. Here's what he had to say about the mission.
Our main objective is to assist various different nursing facilities, nursing homes with additional care, medical care, activities of daily living, to give the nursing homes a bit of a breather.
Since people age 65 and older are at the highest risk for coronavirus infection, the National Guard has been sending teams throughout the state to augment nursing home staff. One of the skilled nursing facilities that Guard members have visited recently is Sacred Heart Home in New Bedford, Massachusetts. Here's what Jen Davis, the administrator there, had to say about the National Guard.
I think initially just the fact that our staff felt recognized, that people felt, wow, there's other people out there that care and that want to help us in this fight, was really energizing for people that have been really working close to around the clock. And then certainly to physically put hands-on with our residents and hands-on with the tasks in our building has been a great help and a great respite for some of our caregivers as well.
The teams have been helping with a variety of tasks, including skilled nursing care, logistics, and facility management. They have also provided personal protective equipment control, established donning and doffing stations, and training to nursing home staff, according to McAndrew. Soldiers and airmen are working jointly in the various teams for Task Force Raptor. Here's what Army Sergeant Connor Fallon, Task Force Raptor Team Golf, had to say. "Our role here has been to help out with patient care and to help install PPE practices that will help the nursing staff here prevent infection to the staff and prevent spreading infection between different residents at the facility." Close quote. Fallon works as a professional firefighter in his civilian job, and for the Guard, he serves as a combat medic instructor for the 101st Regiment. This mission has allowed the residents to meet and connect with new people since they haven't had any visitors besides the nursing home staff in several weeks.
Many of our residents here are long-term residents. Some of them have been here for 3, 4, 5, 10 even years on a few cases. So just to have additional support and to have some new friendly people here to just interact on their daily life and to just give them some extra cheer and extra courage has been helpful.
This mission began on April 29th when these medical professionals reported to Joint Force Headquarters to be briefed on their mission. Since then, the teams have been mobilized across the Commonwealth, and each spends a week or more at a nursing home before being assigned to a new location.
We're kind of used to responding to emergencies. We're used to making decisions or making quick decisions, and I think that's really helped us be effective very, very quickly. We've only been here 5 days, and we were integrated within hours. So I do think that just the nature of the National Guard response model has kind of helped us. It's been seamless. We hit the ground running.
On May 14th, Governor Charlie Baker and members of his staff gave an update on the COVID-19 virus and response in Massachusetts, which included highlighting the ongoing medical missions by the National Guard. Mary Lou Sutters, Massachusetts Secretary of Health and Human Services, said,
"They've been heroes to us. Whenever we've had a need, they just literally step up."
This has been a 102nd Intelligence Wing News Update. For more news from the Wing, visit our website at www.102iw.ang.af.mil or search for 102IW on any major social media platform.